There's a number of reasons that scars form in someone who's got acne. You've got the inflammation beneath the skin, and that stimulates increased pigment, that dilates blood vessels, which causes redness. And the scarring process itself can occur because there's damage to things such as pigment cells, such as collagen, such as elastic tissue. So we see loss of tissue. That normally represents with holes in the skin. We describe them as ice pick in shape, or boxcar, or rolling. But sometimes your skin reacts by making too much scar, and we describe that as hypertrophic or keloid. So there's a whole potpourri of scarring due to inflammation and damage to structures. Well, I think you have to realise two things. Firstly, you need to put the brakes on what's causing your acne scars. So that immediately when you start treatment, the scarring process will stop or slow down, and you'll get improvement in some scar types. So the pigmentary scars, which are too much pigment, redness, or too little pigment, they will improve with time by themselves over a year or two. Other scars will stabilise and improve minimally, but they'll need more medical intervention. The main treatment options for scarring have to be individualised because no two people have the same scar types. So a patient has to be assessed. What's their skin type? Is it fair? Is it medium? Is it dark? What type of scars predominate? Are they pigmentary changes? Are they actual loss of tissue? Are they too much tissue? And then the treatments can be broadly defined in two groups. We speak about a focal treatment. That's what we do to each individual scar. That may be a chemical, that may be a removal, that may be a needling device. And then we talk about the field treatment, where we try and blend it all in and try and, I guess, rejuvenate the whole skin as a whole. So it's focal followed by field, and it's individualised. Well, it depends on how much scarring there is. Let's say we took something simple. The person's come along, they have a few small ice pick scars, they have a little bit of hyperpigmentation, which is too much pigmentation. 2 or 3 simple sessions of a low downtime, minimally invasive chemical peel and needling should fix that for them. You're probably looking somewhere around maybe $800 to $1,000 for all those treatments. Some places may charge more. But if someone's got very deep scars, if they're fibrotic and they're bound down, we need to look at removing them. We need to look at freeing up the tissue. We need to fill up the holes that have been made either with their own serum or a filler, and then we need more aggressive lasers. So that can, I guess, tally up to the thousands of dollars. So it's really anywhere, in my opinion, from about maybe $800 up to $5,000 depending on the extent. I think patients need to be aware that acne scarring sometimes can be like termites in your home. You don't see the termites, but they're damaging your skin. You don't often see big juicy pimples to necessarily have scarring. So if you're seeing something wrong with your skin, some pigmentary changes, some little dents, some little thickenings, speak to your GP. Prevention's better than cure, and it's easier to fix the skin when there's minimal damage.